My name is Charlene Margot, and I'm co-founder of nonprofit The Parent Venture. We are honored and delighted to have with us tonight Stanford's Dr. Bonnie Halpern-Felsher, who's going to be talking with you about safety first and mental health, empowering teens to prevent and reduce drug use. Please join me in a really warm virtual welcome for Bonnie Halpern-Felsher. Thank you, Bonnie.
Great. Thank you so much, Charlene. Thank you, April. And hello, everybody. Great to see so many of you here. I am going to go ahead and share my screen. Hopefully we're looking good here, and I will get started. So you might wonder what the REACH Lab is that I direct and founded. REACH stands for Research and Education to Empower Adolescents and Young Adults to Choose Health. REACH. So just a quick shout out before we get going about all my lab members. I promise I will not read every one of these people to you. It's a lot, but I really like to show the lab because the people who are bringing the work to you is not just me. I am supported by researchers, public health investigators, educators, a public health lawyer, a psychiatrist, an adolescent medicine physician, a full-time graphic designer to make everything look so pretty, and so on. So a pretty large group of people, diverse people, to bring the work that I'm talking about tonight to you. We also have what we call our REACH Lab YAB, our Youth Action Board. We have 38 young people between the ages of 14 and 22, and they work with us as well on everything that we do, from research to education to prevention to advocacy work. And then a special shout out to all of our funders, including the California Department of Education 2-Pay program. So what are we going to do tonight? Our journey together. I'm going to talk to you about drug use rates. And this is not just going to be nicotine. We're going to talk about cannabis, nicotine, and other drugs. We're going to do a quick overview of some drug use. Not so much rates, actually, just the different drugs that are out there. We'll talk about the continuum of drug use. We'll talk about why youth are using, and we'll get to the health risks and signs and symptoms of use, and then what we and what you as parents, educators, and professionals can do. So let's start with, and as Shirley was saying, please do put questions in the Q&A. Feel free to have reactions. I'm pretty good at multitasking and checking on the screens to see what questions you're having as we go. If I don't answer it at that time, I will get to it at the end. So let's talk about the different adolescent drugs or drugs that adolescents are using. So the first one, that's a great question. The YAB members are actually not just from California. They're a pretty diverse group. We get most are in California, but we actually have young people across the entire country, and actually a couple of students overseas as well. And they are, some are users, some are not. We don't ask them. We just have a sense, and they really do help us in everything that we do. So when we talk about adolescent drug use, we're really looking at a change. First of all, we'll talk about tobacco or nicotine, real change in that landscape. You know, as you probably know, we have cigarettes, but young people are not using cigarettes. Very rarely are they. Really what has happened is the new cigarette is really the electronic cigarette or vaping devices. And that's what you see here on the right. And April and I were just talking about this before we went live, that the proliferation of electronic cigarettes, e-cigarettes, vapes, vaping, whatever you want to call them, juuling, puffing, has really exploded over the past, really since around 2015, 2017. Just constant changes in the e-cigarette devices that are out there. They started off looking very much like what I was showing you here, these cig-alikes that look like cigarettes. They morphed to these more vape pens and boxes, and now they're just so different. Juul, Vuse, Flume, Hyde, Puff. And I'm showing you this because as parents and educators and as school administrators, I want you to be aware of the different kinds of products that are out there and what to look for, because it's not easy. And this is not done by accident. I'll show you slides later where we talk about how it's easy to hide these products. And by the way, I do have a couple pop quizzes where I'm hoping you'll put into the chat some responses when we get to that part. This is a picture of some e-cigarette devices that were obtained from a school, not in San Mateo, over in the East Bay. And it was confiscated, and one of my colleagues in my lab laid them out and took a picture. And I'm showing you this again just to show these are all nicotine, one of them may be cannabis, but for the most part, nicotine vaping devices. And there's just such vast differences in what they look like. And we're constantly seeing new devices come out on the market all the time. They look like USBs, they look like hand sanitizers, they look like highlighters. They do not look like a nicotine or a tobacco product. And again, that's not by accident. That's so that way you don't know what your kids are using. This is a quick video of another school who confiscated a bunch of devices. And the reason why I want to show you this, I'll show it to you a couple of times. It's very hard to be able to tell the difference between a nicotine e-cigarette and a cannabis e-cigarette. So the devices on the left, the ones that are more black, metal, plastic looking, those tend to be nicotine e-cigarettes. The ones that are glass and metal tend to be cannabis e-cigarettes, but you really can't tell the difference. And what we're hearing from young people is that they actually will vape or use, say, half of the nicotine e-cigarette and then add cannabis oil to it. And then they've got the double whammy. They've got a flavored nicotine cannabis device. Let me show you that video one more time just so you can see, but it's very difficult. And again, I'm really trying to show you this so that way you as parents and anybody else listening pay attention to what might be in your kids' backpack, closets, bottom of their bed, and so on. And we worry about these e-cigarettes, electronic cigarettes, because they have high amounts of nicotine in there. This is not a talk on the health effects per se. It's a little broader than that. Always happy to explain this more, but the bottom line is that the newer e-cigarette products have the equivalent of the nicotine that you would find in over 300 to 400 to 500 cigarettes. And for example, Juul, that really started this big vaping epidemic in 2017, but Juul came on the market in 2015. It had the equivalent of about a pack to 2 packs of cigarettes worth of nicotine. But if you look at the newer products, Flume and Elf Bar and so on, you're looking at multi-fold levels. So huge amount of nicotine in e-cigarettes. And young people are using these on a pretty regular basis, and they're becoming addicted to the nicotine. We're also know cannabis. These are just different names. Cannabis, as I've shown you before, is becoming quite popular as well. And cannabis can be used in smoked, vaped, edibles, all different versions of cannabis. And we're worried about cannabis because the amount of THC, that's the psychoactive component that's in cannabis, has dramatically increased over the last couple of decades. Right now, what it used to be 3-4% nicotine, right now it's upwards of 15-20%. Dabbing, which is a highly concentrated THC, is 80% THC. And what we often tell people, just with a regular joint, for example, not even a dabbing that's highly concentrated, just a regular joint, one joint today is worth about 10 joints when I was a kid. So at least 10 times the concentration of THC than when we were children or when our parents were kids even. So when we talk to teens and they say, it's just THC, you used it, or your generation, and whether you did or not use it, it's a totally different drug right now and very, very strong. So you can also vape your caffeine, your vitamin Bs, your melatonin. You can kind of vape anything that's out there. These are new devices that have been coming out. They're not regulated. They are sold over the counter. There's no age restriction. You can get these at Urban Outfitters. You can get them online pretty much anywhere. And my concern about these products, and teens are using, we publish papers on this in our lab. The problem with these devices is that, yes, they might not have nicotine, and yes, they might not have THC, but they have propylene glycol, glycerin, flavors, all kinds of other ingredients that's very harmful to the developing lungs and developing brains. We also are worried because young people seem to be moving from vaping these things, caffeine, melatonin, etc., and then moving to nicotine vaping and then moving to cannabis vaping. So we're very concerned about basically vaping anything and what it's doing to our young people's hearts, lungs, and brain. There are also other drugs that we worry about more and more, and these are becoming more popular in the news. And what I'm really talking about, oral nicotine products. You probably have heard of Zyn. Zyn has been in the news a lot lately, but we also have, so Zyn is a nicotine product that you put in your mouth and hold it there in the gum area, and then you absorb the nicotine. We also have tablets and toothpicks and gums, all with nicotine. And the scary part is young people are not using these products, excuse me, as an alternative or to get off of smoking or e-cigarettes. They're using them as a starter. And one Zyn, for example, is 3 to 6 milligrams of nicotine, but young people are using multiple of these a day and getting a tremendous amount of nicotine. And then fentanyl. I have to mention fentanyl. There was a recent perspective piece that was done by one of my colleagues, Scott Handlin, and his colleague in the New England Journal. And what he wrote was that every week in 2022, the equivalent of a high school classroom's worth of students, an average of 22 adolescents, died of overdoses in the US. And 75% of those drugs deaths had illicit fentanyl. And we're seeing this more and more and more right now in 23 and 2024. So fentanyl is not a joke, and we need to talk to young people about it. There's been some current concerns that even nicotine and THC products might be laced with fentanyl. We know that young people are just buying pills off the internet, thinking that they're getting a pain pill or something else, and it's laced with fentanyl, or it's fully fentanyl, and they are dying. And that is what we need to really worry about as well. And I'll tell you some methods to think about and how to help keep kids safe in a little bit. All right. So when we talk about the continuum of use, this is important because not all kids are your drug users. In fact, a lot of the young people who have died from fentanyl, according to their parents and their friends, were not heavy drug users. They may be used once or twice. They bought a couple of pills with a bad back, or they're trying to stay awake at night to study for finals. A couple of the college students I know who died. So I don't want to give this feeling that everybody who's using any of these drugs are kind of your druggies. I don't want, and we'll talk more about stigma, but when we talk about mental health, it's really important to realize that there's a continuum of use and a continuum of reasons why young people are using. So we certainly have a majority of young people have not used any drugs. And you could go from not using to recreational use, using once in a while, or using, or more experimental use, I should say, where you've tried it a couple of times. Then recreational, maybe using it on weekends, maybe using it at a party, but no times others. But then some young people do transition into regular use. We've seen this more and more with nicotine, for example, that while we have fewer teenagers starting e-cigarettes, those who are using pretty regularly. 20 out of 30 days in the past month, or even daily. And part of that is the huge amount of nicotine that's in these products that I mentioned. But same thing with THC, a lot of young people are using pretty regularly. And then we worry about young people really moving into not just use, but misuse and substance use disorders and physical dependence or addiction. And this is where it's really affecting their daily lives. They're using regularly. Substance use disorder is where they're using so much that they're actually changing their body chemistry, changing their brain chemistry, and really it's becoming a problem for daily use. If you email me, I have my email at the end, I can send you that paper at all, but it's Scott Handlin. He's a pediatrician out of Harvard. So you really have to think about the continuum of use from never use to physical dependence. And you could be dependent on nicotine, but not on THC, and just sometimes using THC, vice versa. There's a lot of continuum that we have to think about when we talk to our young people. What is it that they are using and how often are they using? So let's talk about why it is that young people are using. Well, there are probably hundreds of reasons why young people are using. So I'm only going to touch upon a few, and particularly the few reasons that you as parents, healthcare providers, school personnel, school teachers can really help and help try to do something about. So first of all, when we talk about decision theories applied to adolescent risk behavior, in this case, drug use, there's a lot of theories. My research started with adolescent decision making, and I still do that. Why is it that adolescents make a decision to use a drug, and then why is it that they continue to use? Part of why they continue to use is that they become addicted, and they potentially have a substance use disorder. But why is it that they start in the first place? Well, some people say that adolescents are taking these risks because they can't judge risks appropriately. They believe that they're invulnerable to harm. Maybe they're pressured by peers. We'll talk more about that. Or maybe that they have poor decision-making skills. Some people would also say, or I say, this little lightness here, the 3 I's of adolescence, that they think that they're invulnerable, invincible, and infertile. But in reality, there are real and perceived risks and benefits to using drugs. When you talk to a teenager and you simply say, it's all bad, and a teen says, well, but I enjoyed the high, or, but it made me feel good, or I like the flavors that were in e-cigarettes, or the buzz, or it made me have more concentration, which is not true, but that's what they think. And then we tell them, no, that's not true. It's all bad. We lose credibility. They don't listen to us anymore. It's the same thing when you talk about, sex is bad and you're going to get pregnant. Well, I enjoyed it and I didn't get pregnant, so you're totally lying to me. So we need to understand where teens are coming from. We need to understand that teens are coming from the perspective of real and perceived benefits. And teens are not blank slates. They're not coming in thinking, that they're totally invulnerable. They're not coming in unable to make decisions. They can make decisions. What they put into the equation is sometimes different from what we adults put into the equation. For example, teens will think and they'll weigh, and we're going to do this together in a minute, but they'll weigh things like, oh, well, I realize it might be bad for me, but I want to party, or I want to fit in, or I want to look good for my group. Well, as adults, we tend to learn, hopefully by now, well, that's not real important. But to a teenager, those peer influences, looking cool, fitting in are really, really important. So we have to think about that when we try to put ourselves into an adolescent's headspace. So, if you think about it, what are some, I'm not going to ask in the interest of time, but spend 30 seconds thinking, what are there some good things about and your drug of choice? Maybe not that you're using, but any drug that you want to think about. What are some good things about alcohol? I'm sure a lot of you drink a glass of wine with dinner or on weekends or when you go out with your significant other. Why? What are some reasons? Why are some reasons why you enjoy anything that might potentially be a risk behavior? Now put yourself in the shoes of a teenager, and what are some of the good things about it? So for alcohol, for example, a young person often feels like, well, by drinking, it's easier to socialize, more chatty, might be more willing to dance or to sing, feel more confident, feel less nervous or anxious. Psychedelics, hallucinogens, they might feel like there's a spiritual experience, or boy, I now have some answers to existential questions. And young people are asking questions. Maybe they feel like they're learning about themselves. Maybe it helps them break painful connections or to others. Or maybe they feel like it's addressing mental health challenges. We'll talk about that more. Now, you may say, well, that's the perception, that's not reality, but it's a teenager's reality. And we really have to come from their perspective when we try to understand why they're engaging in these risk behaviors. And then let's talk a little bit more about peers. So, to a teenager, again, putting yourself in the mindset of a teenager, not in our mindset as adults, they think about social norms. They think everyone is doing it. Well, if everyone's doing it, then I need to do it as well. When we talk about peer pressure, today's peer pressure is not, come on, Bonnie, come on, Bonnie, come on, Bonnie, do this with me. It's more like I go to a party, I see so-and-so's having fun on the couch, sipping alcohol, so-and-so's having a good time vaping, so-and-so seems high, but is really chatty, and I'm shy, and I'm not sure, maybe I'm gonna try it. And the everyone is doing it might be 10%, maybe 20%, but to a teenager, it feels like a lot. The other piece is, to a teenager, it's hard to say no. When we think about risks and benefits, real or perceived, there are risks to saying no as a teenager. It's hard for a teenager to say no. So what do? One of the things that we need to do is we need to teach teens and talk to teens about how to resist peer pressure, how to resist the problems with saying no. So there are a few things that you can, that I told my own kids. My kids are basically almost 24 and 28, but when they were, they were in high school and middle school, and I would say, you know what, I don't like you lying, but this is one time when it's okay to lie. Somebody hands you a drink, I've tried alcohol, I don't really like it. Or, you know what, when I get home, this was one of the tricks my adolescent medicine friend would use, that her kids can stay out. She didn't have a very strict curfew, but they always had to kiss her goodnight when they came in, because she could tell whether it was alcohol or cigarettes on their breath. So, or on their clothes. And so as a teenager, you could teach your teenager to say, you know what? When I go home, my parents kind of check to see if I've used anything, and I don't really want to get into trouble. Or I've tried it and I just don't like it. Or I've tried it and yeah, it's fine. I don't feel like it tonight. Or I'm driving. Any of the reasons that they could do. I've also told teens, take a glass, hold a glass of alcohol. And this is assuming nobody's going to walk in and bust you. But as a parent, you can have that contract with them, a verbal contract or even a written contract that, yeah, I understand you might hold it, but you're going to dump it out into a planter or plant. We kill the plant, but you stay safe and not driving home drunk. Whatever it is, to have a conversation with young people about how to risk peer pressure. We have some of those ways in our curriculum, and I'll point out that curriculum at the end. All right, some other reasons why young people are using. We'll get into some of the things. So the first one has to do with decision making and how you as a parent, trusted adult, can have and partner with young people to help them make healthy decisions for themselves. The other is that there are external influences, marketing and flavors, for example. I'm going to have a pop quiz. Why don't you put into the chat? And if you've heard my talks before, you can't cheat. But how many flavors of e-cigarettes there have been on the market over the past few years? Total number. Go ahead and put that into the chat. When you look at something like these that you're seeing before you here, these are e-cigarette flavors, and just a few, and they're the ads and the packaging. The e-cigarette companies say these products are there to attract adults, to help adults quit smoking. Well, we can talk in the Q&A about whether e-cigarettes help adults quit smoking cigarettes. The answer is not very well. But even if it did, these products here, these ads, these looks like juice boxes, looks like candy. This is attracting our kids. This is not attracting adults. All right, so keep putting in. Thank you for those who are playing along. This is just some examples of some of the flavors of e-cigarettes that we've seen on the market. And I'll give you the answer. The answer is over 15,000 flavors. So again, when e-cigarette companies say sugar booger, or excuse me, say that these are for adults, adults don't need sugar booger or honey doo doo or dragon's blood or unicorn poop or anything else to be able to attract their young people, to attract adults. I mean, these are squarely attracting our kids. And this is one of the main reasons why young people say that they use. One more pop quiz for you. Go ahead and take a minute and see if you can see how many e-cigarettes there are in this picture. Anybody want to play along? You've got 8, 6, 6, 20. Ooh, 6 or 7, 3, 6. All right. Good, good. All right. You're close. There are 10. And part of why I show you this is one of the desks in my lab. And the reason why I show you this is it's really hard to see these products. Remember what I was saying to you earlier, how the proliferation, the changes is constantly happening right now with these products. When you look at these vape pens that are in amongst pens, you can't tell as a parent that, and I can't tell, and I'm trained in this. I couldn't easily find this. I can find some of the others, but it looks like a pen, looks like USBs right here. Some of the older ones look just like a highlighter, and I'm going to show you more of those in a minute. You've got some of these, the Flume and the Elf Bar that look like, this is Peach Mango is gel, hand sanitizer. Here's one here that looks like a highlighter. It's really hard to tell these products, and that's, again, not by accident. Here's a newer e-cigarette product that came on the market in the last year that was all over the news. This is called Highlight, and that's not a play on words. Well, it is a play on words. Highlight. It's actually a highlighter. It works as a highlighter, but it's an e-cigarette. And this is infiltrating all of our teens right now. And I could do an entire hour just on marketing. Another one is it's easy to access. I think this is my last pop quiz, I promise. What's the age to purchase tobacco in California and the US? What's the legal age to do so? Go ahead and put that in the chat. All right. Love it. About half of you were right, about half of you were not, and I love it because my goal is to teach you. The legal age is 21, both in California and in the United States. It got signed into law in California in 2016 and across the nation in December of 2019. You have to be 21, and by the way, 21 in California for cannabis as well, and certainly for alcohol. But for tobacco, it's 21. And the reason why, and by the way, those of you who didn't know, you're not alone. We're actually going to submit a paper for publication that also shows that about 60% of adults don't realize that it's age 21. Why should you care about this? Because we have vape shops and cigarette shops and tobacco shops and cannabis shops and 7-Elevens and so on that are selling these drugs to young people. Under the age of 21 and under the age of 18. And so we really need to be vigilant, and you as parents and community members need to be vigilant and need to report vape shops or other shops that are selling to under 21. We do have some in San Mateo. I live in San Mateo, by the way. We do have some here, and we have reported them. So be vigilant and keep an eye out. The other problem is when you see a sign like this, local discounts, student discounts, you know, if you've got age 21 as the legal age, the majority of students are under 21. You graduate from college around 22. People like me and a few others on here have stayed in school forever, but for the most part, people graduate around 22. When you see student discounts, the majority of students are under 21. This is attracting our young people. Mental health and stress. Let's talk about that. This is a big reason why young people use. Right now, youth are incredibly stressed, especially during the pandemic. And I know that we're not in the pandemic anymore, although people are still getting COVID, but we know that young people have been stressed. And since the pandemic, they really lost, we all lost a couple of years. And young people are still dealing with it. They're still having issues with socialization and so on. And there was the Youth Risk Behavior Survey, a national data set that showed that more than 44% of students in 2021 reported feeling sad or hopeless, compared to 34% in pre-pandemic times. And 25% of high school students had suicidal ideation. So we know that youth are more likely to use substances when they're feeling depressed or anxious. And in fact, we are about to publish a study that showed that youth who are feeling depressed are more likely to co-use cannabis and tobacco at the same time, or within the same day. So this idea of reciprocal relationship is very hard to know whether tobacco or cannabis use leads to mental health issues, or mental health issues leads to use. It's often bidirectional, both ways, but we know that it is a major reason why young people are using drugs is mental health. And why? What's happening? Well, when our bodies are stressed out, we tend to sleep too much or too little. Often we have low energy. It's partly why young people also, or anybody, any adult too, turns to eating a lot or drinking a lot, because our bodies are feeling low and low energy. We might have physical symptoms like headaches or stomach aches if we have stress. We might feel confused, on edge, or scared. Often you might be sick more often than when you're not feeling depressed. And sometimes when somebody's super depressed, they might be having trouble performing just daily activities that's going on. And when this happens, young people are more likely to turn to drugs for self-medication to try to help themselves feel better. And so anybody might be responding by choosing activities that they think will help them reduce stress, like drugs. Self-medication is defined as when someone uses substances to repeatedly and consistently deal with stress, anxiety, depression, or other mental health issues. So as parents and trusted adults, we need to help teenagers and children and young adults learn how to manage the stress, help them understand where the stress is coming from, and make their journey to be a healthier person rather than turn to drugs. And that takes some time. It's not just saying to a teenager, you're stressed, but don't use drugs. We need to understand, and we need to get to the root of what's happening. So in our curriculums, we have a whole bunch of exercises, breathing techniques, and so on that you can do with your kids to help them deal with stress. You can also talk to them and set some sort of a contract or a way to help them cope with stress, help them sleep better. Some teenagers say listening to music is really helpful. Some teenagers told us that when they're going through a withdrawal from nicotine, the real strong symptoms would last a few minutes. In that process, they would have songs on their playlist, which would be about 4 minutes, because their withdrawal was lasting about 4 minutes. So they put on the music, the 4 minutes, and it would help them get through their withdrawal. So listening to music helps in a lot of ways. Talk with a friend, talk with a trusted adult. Exercise really helps. Meditating, watch a movie and have some popcorn, paint, garden, whatever, cook, whatever it is that your kids find helpful, to have them understand that that is a really good option to help them with stress. It's also important to have teenagers understand that everybody has stress. Stress is not necessarily bad. You can have good stress too. Um, but stress is normal. It's how we deal with it that's really important. My older kid used to get stressed a lot. And so a teacher told her to have a rainy day box. It was literally a box and it had pictures and memories that were really important to my older kid. And whenever they were feeling sad, they would take out the box and just go through it. And that really helped them get through that moment. And I was mentioning at the very beginning about stigma. It's really important that we don't stigmatize drug use and don't make assumptions that somebody who's using drugs are having problems with mental health, or that somebody who's using drugs are bad people, or worse, or bad grades, or one of those kids. It's not my kid. It could be your kid. It could be your friend's kids. That it's not, that means that they're bad people, and this is important. So stigma is a mark of disgrace or shame that's associated with a person or group of people. And it could lead to people being stereotyped and discriminated against. And we don't want that happening to any of our young people right now. So really working on, if your child is not using, but their friend is, hey, Johnny, that your friend's not a bad person. You're not a bad person. We are really trying to work together to help that person get through their mental health issues, or to get through their drug use, or whatever combination might be going on there. Yeah, exactly. Thank you. Urge surfing. And that's similar to what the teenager was talking about with me for putting music in their ears. Thank you, Chris, for adding that. That's a really good technique. I like that. So we'll talk more about resources at the end, but I did want to, because we're talking about mental health, you can text 988 or go to the emergency room. As a parent, you can do this as well with your young person if they're really seeking some help because of some mental health issues. So know that help is there. You don't need to be the hero. You don't need to be feeling bad. You don't need to feel like you have all the solutions. Drug use, mental health issues are real, and they're very difficult to deal with. So please know that you can reach out and get help, and you do not need to do it all the time yourself. So how do you know if somebody might be using? Well, there are a few. You may not know. You may not know, but there are a few different things you can look for. Changing clothing, baggier clothes, hoodies, hats, because they're either covering, or sunglasses, they're covering up bloodshot eyes. They're covering up and trying to hide the smoke. Teenagers will use sweatshirts and blow the smoke into their, or aerosol into their sleeves, so that their change of clothing may be happening. They might be going through depression or withdrawal, moodiness, irritability. I know teens are often going through that, but I mean beyond. You generally know your kid suddenly had a change in personality, suddenly had a change. Maybe they're not communicating as much with family members, with you. That might be because maybe if you have dinner together all the time and you suddenly notice your kid can't sit still during dinner or keeps running to the bathroom, maybe it's because they're going through withdrawal, or they're feeling the need to take that hit on the drug. School might not be going as well, or they're more truant. That's another way of knowing. And then physical changes. If you suddenly start hearing or seeing coughing, trouble breathing, headaches, could be COVID, it could be a cold, but we also worry about lung issues, heart issues, addiction, withdrawal. And again, I'm not going into all the health effects per se, but in this, I've done that in other talks. I'm happy to send you those slides, but we do worry about the concerns there. There are a lot of different concerns. We worry about physical harms, academic, mental, legal harms that are there. And I won't read all of these to you. I'll leave it up for a second. But there are a lot of different health harms and social harms that we worry about with young people. Not if they're using once, although they could get caught. I do know teens who've used just once. They tried it once on school campus. I'm sure you know of them too, and they got caught and they got in trouble. But more continued use, and the more one uses, the more likely they are to have health harms and social harms. We really start to worry about young people. And then the health effects are real. Changes in brain, lung, heart, and so on can happen with any of the drugs that we're talking about. Fentanyl certainly slows down your breathing and you could die. Not something to take lightly there. All right. So what can you do? Just taking the chat. Okay. So a few different recommendations that you could do. One is it says cannabis there, sorry, talk about dangers of all drugs. So if you're a parent sitting here listening today, I would say when you're done, it'll be early enough in the evening. Don't have these conversations with teenagers at 10 o'clock at night. But it'll be 6:30, 7 o'clock when we're done talking. You could go and say to your teen, hey, I just heard a webinar on drug use, and can we talk about what I learned? I'd love to hear what you know. Not accusing them. It may take several times before you find out whether or not they're using, but really having a conversation. I'll show you that more on the next slide. You can talk to a healthcare provider about ways to quit, and you're going to hear from two people in your schools in a little bit. You can talk to your county public health department. They have local resources for alcohol, tobacco, and other drugs. So again, not to be alone on this. There are resources for you. So it's really important to start a conversation. It's not a lecture. I don't want, it's not, it is finding the right time. Just say I'm going to schedule it for, April 1st at 3 o'clock. I'm going to sit down and have a conversation with my kid. It doesn't work. My kids would laugh that I was like the queen of finding optimal times to have a conversation with them. Like I said, talking about this webinar, or you see something on TV, or you see something in a magazine, use that as a starting point to have that conversation with people. You want to avoid things like, we need to talk, or you don't use, right? Because what are they going to say? If you say you don't use, right? What are they going to say? No, I actually do. And that you might not find out the truth right away. So we need to have honest drug education with young people. That's the most important. We need to normalize drug education communication, not normalize drug use. My point is, talking to young people about drugs is not going to get them to start using. It's going to get them to listen and understand. So just quickly, because I know we're running out of time, we have a curriculum called Safety First. We have a bunch of curriculums in my lab. These are all free. I'm not selling anything. And I think Bev did and might again pop some of the links into the chat. But this is a harm reduction drug education curriculum. So we, of course, don't want young people to use at all in the first place. And if they are using, we want them to cut back and quit. But if young people are continuing to use, we want them safe. That is the most important piece. So something like Safety First or other curriculums like this, of course, we see abstinence as the most important point. But we want to recognize that some teens will use. And remember, I talked about decision-making at the beginning. If they do use, we really want to encourage them to be safe in doing so. So this particular curriculum has 13 lessons on all areas of drug use, brain, and addiction. But you as parents, and it's used in schools, but you as parents can also use some of the information just to have a conversation. And we need to have these harm reduction messages, so not to use it all if they are using, to help them quit or cut back. But if they are continuing to use, let's help them reduce their harms. So some of what's in here that I want to bring to you as parents to have a conversation with your kids about, like I said, not using, but if they are, let's talk about knowledge and policies and dose and so on. I'm going to go through these very quickly. So dose and dosage, even with anything like Advil or any prescription drugs, you want to know how much and how often they're using. You only want to use as recommended. If 200 milligrams is enough to get rid of your headache, don't go to 600. Don't go to 400. We need to really help people understand what the dose and the recommended is. Well, it's the same thing with illicit drugs and hard drugs. We want to be able to help them understand what's the minimum that they need to be using to keep themselves safe. We need to talk about set and setting. Part of why, as I mentioned, young people use is that they're depressed. So we need to make sure that they're not using when they're depressed, not using when they're alone, not using when they're driving, because that is the most dangerous time to use. We have to watch out for adulteration. And this is where the fentanyl comes in. Teens don't know what they're getting. They're getting it from each other. They don't know if it's nicotine, THC, fentanyl, hallucinogens. They don't know. So we should teach them how to check their drugs. And that's really important. I don't mean drug testing your kid. I mean checking the drug. So we have an activity in our curriculum about adding sugar and salt to different pitchers and saying to teens, you can't tell by looking at it what's in there. So how do you know that the drug you're taking is really the drug you think it is? We also need to help young people not mix drugs. That can be incredibly harmful as well. And then most important, talk to your kids about calling 911. Good Samaritan laws. In California, we have very generous Good Samaritan laws. What this means is if you, as a teenager and an adult, by the way, have drugs on you and somebody passes out from drugs, you call the police, you call 911, you call an ambulance, you are there. Police will not arrest you. They will not bust you. They might confiscate the drugs, but they will not bust you. And that's important. We need to normalize calling for help because we have too many young people dying right now. How to help put them in a recovery position. We have a whole set of curriculums on teaching young people how to turn somebody over and make sure that they're breathing properly. And then using Narcan. I carry Narcan with me. This is really important. You cannot, if you use Narcan on somebody, this is for overdose, opioid overdose, if they've not used opioids, they're not going to die from you giving them Narcan by accident. It's okay, and we need to use that. So all of these resources are completely free and available in our lab. We've got information on fentanyl, different fentanyl fact sheets for you. I am speeding up. I'm sorry. I'm seeing time and I want to give our other guests some time to speak. We've got quitting tips for you in there. And then I will hand it over to Jessamy for this part.
Thank you so much, Bonnie. Thank you for being here with us today. We're so happy that we have you in our community. And we use the Stanford Tobacco Prevention Toolkit and Cannabis Awareness Toolkit in our work. I'm your tobacco use prevention education mental health therapist at San Mateo Union High School District. My name is Dr. Jessamy Cadigan. And these are some of our programs that we love. We truly love having these conversations with students. We consider them life-saving. I want you to know that we have these programs are open to all of our community at San Mateo Union High School District. You're able to self-refer parents, students to our vape awareness prevention education group that's on Mondays. It's focused on nicotine. We often do cover co-use. We have a substance use support program that's 4 weeks, and we do THC, alcohol, psychedelics. We do continuum of use, all the things that Bonnie covered, we cover in our groups. We also do, that's 4 weeks, and we do brief interventions with students, which is a manualized treatment where Amelia or I, and sometimes Amelia does a brief intervention with a student, and then I'll do a brief intervention with a student, an opportunity for us to work with them individually. And we kind of, one of my favorite metaphors is that if you don't go in the ocean, you don't have to worry about getting bit by a shark. However, if our students are going to go in this ocean and go in the sea and navigate this water, we want them to navigate it safely. So we offer a lot of the harm reduction techniques as well as opportunities to help our students quit. We do also work with parents. And so my brilliant and amazing colleague, Amelia Nash, is going to tell you a little bit about our parent support programs. Thank you so much, Bonnie. Thank you so much, Amelia.
Perfect. Yes, our first one, this is new this year, and this is specifically a support group for parents whose students are definitely using weed, nicotine, drinking. Usually they come to, I do that group, they come to me because they got caught at school. So any guardian whose student has come through one of the programs that Jessamy just talked about gets invited to come to this group and learn just a lot more about substances as well as ways that they can support their student. And then in the next slide, we also have another group called Parent Connect. And this is really more for students who are having trouble being at school, truant, tardy, and they have 7 weeks of sessions. And one of the weeks they do focus on substance use, but they have a lot of other more general things about how to talk to students. So those are both available for parents in the San Mateo Union High School District. And that's all that we have.
Great, thank you. There is a question, well, let me go to the last couple slides and then we'll do those questions because that's a really good one. I just wanted to mention to you all that we do have a cannabis and tobacco conference coming up. Parents can attend. This is the only thing that we charge for. Although if you are a parent with absolutely no means, let me know because we do have a few scholarships that we can give. But this allows for 2 days of different teachings and trainings and information all about cannabis and tobacco. And parents, you're welcome to follow us on social media. We push out all kinds of updates and information and articles and science. So feel free to do that. And then I'll leave this here for a second. That's my email, although I will give you my easier email in a second. Oh, I don't think I can do that. Yes, everyone. They're the same email, by the way. It's just one's easier to type. And if you scan that QR code, you can get on our mailing list. We don't over email you, I promise, but that allows you to have all the resources and updates that we have and newsletters and things like that. So I will stop sharing. And I think we have a couple minutes. And Jessamy and Amelia, there's a question about Carmont schools and what programs are there, and I can't answer that.
So I don't know that much either. I do know that they have some really great student programs there. And I think my email is on my slide, or I can put it in the chat and you can email me and I can help. I can help find out more. Yeah.
Okay, thank you for that, Jessamy. And Dr. Bonnie Halpern-Felsher, this was incredible tonight. Such a rich discussion, and everybody who's on and been on with us, really thank you for being here. I want you to know too that Bonnie and her REACH Lab are incredibly generous. Those resources that she's mentioned are free. The conference is really the one thing that they do every year that helps fund them. But she's here tonight, again, as a pro bono service to the community. So again, big thanks to you, Bonnie, for being so generous. Anybody else? Questions? We are open. Otherwise, it sounds like somebody was asking about the research that you shared, Bonnie. Is that a link that we can send out to people?
Yeah, I have to find it. His name is Scott Hadlin. I'll put it in the chat. But if you email me, I can find the article and send it to you. It's a perspectives article, but also I've got a lot of articles, science and news articles on a lot of the things I talked about. So if anybody wants a goodie bag, send me an email. If I don't respond for a day, just resend it because I'm a little bit behind having just traveled. So nudge me and I'll get you any information that you might want.
Bonnie, do you mind putting the slide with the QR code back up? I want to tell you all that this conference is amazing. You have like, how many? 50, 70 speakers, Bonnie? Some incredible number?
Oh, this year. So this is that's the one, you mean this, that QR code. Yeah, thank you, Charlene. We have this year 2 keynotes. Well, one's a panel, and then we have 56 workshops. And everybody who's listening to this, even if you cannot attend, it's virtual, but even if you cannot attend live in real time, don't worry, we record it, and anybody who registers gets access to this for an entire year. And even if you attended in real time, you can't go to 56 workshops in 2 days. So we record it, and people go back and watch it over time.
All right, and these are really the nation's top experts, so everybody highly recommend that. Is there another QR code, Bonnie, that people might have wanted?
There you go.
Okay, there we go.
Thank you.
Okay. Well, we have just about come to the end of our hour together. Dr. Halpern-Felsher, do you have any final words for everybody who's been on with us tonight?
I would just say, parents, I feel for you. I know how challenging this is. We all do listening. Everybody who's on this panel tonight. We're here for you. There are resources available. Keep talking. It's the most important. Talk to your kids, have conversations, have honest conversations, that's science-based and not emotion-based, would be what I would suggest.
Wonderful ending, Bonnie. And as we always used to say to parents, this is an education series. So, your homework is to go and find a kid and do just what Dr. Halpern-Felsher said is, I heard this thing today. What do you think about that? What do you know? So parents, be open, be curious, and listen. Thank you all for joining us tonight. It shows that you care. Special thanks to Dr. Bonnie Halpern-Felsher, Dr. Jessica Cadigan, and Amelia Nash. Appreciate you all being here. Take care, everybody. Hope to see you again soon. Good night.